The prevalence of attention deficit hyperactivity disorder, also known as ADHD, has risen, which may be attributed to greater awareness of the disorder. However, rates have reached an alarming high. The true prevalence of ADHD established by the American Psychological Association is 5% of American children. However, the percentage of children reported to have been diagnosed is over double that at 11%. The discrepancy between the true prevalence and the percentage of people currently being diagnosed is a result of increased cases of ADHD being misdiagnosed. What I argue to be the driving force behind this is pharmaceutical companies, also known as Big Pharma. They have powerful influence in promoting ADHD diagnoses for the pursuit of profits from increasing medication uptake. I will also argue that upholding the medical principle of non-maleficence, health professionals should not allow pharmaceutical companies to bias their medical decisions because failure to do so can result in harm to patients through 1. Unnecessary side effects, and 2. Abuse of prescription stimulants. Big Pharma has contributed to increasing cases of ADHD misdiagnoses through their influence on 1. The public, 2. Doctors, and 3. Researchers and studies. Big Pharma influences the public through direct-to-consumer pharmaceutical advertising, DTCPA. Proponents argue that DTCPA raises greater awareness about ADHD and educate individuals on more medical options that may have not been proactively introduced by their healthcare providers. A study demonstrated the effectiveness of DTCPA through the result that for every $28 spent on advertising of a pharmaceutical, a patient is prompt to visit their healthcare professional within the next 12 months. Despite evidence that DTCPA promotes doctor visits and doctor-patient discussion, opponents of DTCPA argue that these appointments are not necessarily positive and productive. Individuals who are convinced of Ritalin's instant benefit after viewing advertisements may proceed to pressure their doctors to prescribe it even if it is not warranted. If the doctor refuses the request, the patient may also refuse to accept any alternative treatments and seek out another doctor who will write the prescription. In the case that the individual reluctantly acquiesces to the alternative treatment, the nocebo effect may occur, which is a self-fulfilling prophecy of their negative expectations about the alternative treatment. Companies that sell ADHD drugs often exploit parents' fears and concerns for the children, indicating that the children can get better grades or do more chores if they took the advertised drug. Here's an advertisement of a boy in a green monster costume taking off a mask to reveal his gentle and loving smile. The title reads, "His ADHD symptoms can be disruptive, but there's a kid in there. Now there's a new way to help him out." This alludes to the idea that by taking the medication advertised, parents can finally interact with their loving and well-behaved child rather than deal with the monster that the child could be. Despite the regulations imposed by the Food and Drug Administration, FDA, to ensure pharmaceutical advertising is not false or misleading, most major ADHD drug companies have been cited for failing to meet requirements. For example, a YouTube video posted by one of the drug companies included paid celebrity spokesperson Ty Pennington. In it, he declared that medication literally changed my life and gave me the confidence to achieve my goals. However, no study has been done to support that stimulants changed lives and increased confidence. After being warned by the FDA and given the option to remove misleading advertisements or to provide evidence for their claims, drug companies often would choose to do the former. They knew at this point that the advertisement had already been long enough to make the intended impact. Pharmaceutical companies employ countless methods in getting doctors to buy into their medications, such as giving out drug samples, paying for meals and trips, granting research funds, or funding medical education. It can be argued that promotional encounters with pharmaceutical companies can help educate doctors on new medical treatments that they may otherwise be too busy to acquire on their own. However, it cannot be ignored that the drug representatives have the primary purpose to promote their drugs to doctors so they can be prescribed and sold. It may appear that only neutral information is being exchanged, but psychological techniques can effectively influence doctors at an unconscious level. An example is the mere exposure effect, whereby liking is increased simply due to repeated encounters. This can operate simply through a repeated exposure to the drug's company logo. A prominent ADHD researcher, Dr. Russell Barkley, is one of many doctors who have been paid by pharmaceutical companies. He received around a third of his income from drug companies and consistently claimed that individuals with ADHD who do not medicate are at risk for horrible fates like drug dependence, car accidents, and contracting sexually transmitted diseases. He also deliberately conducts studies on children with severe ADHD so that the benefits of medication would be amplified. When doctors and researchers accept payments to endorse a drug company, there is a conflict of interest between their patients and the drug company. A doctor's main duty is towards the best interest of their patients, so having ties with a particular drug company is a major breach of ethics for informed consent if doctors fail to educate patients on other potential treatment alternatives. Now that we've discussed the powerful driving force behind the alarming rates of ADHD diagnoses, let's turn to why this matters. Increasing cases of ADHD misdiagnoses followed by unwarranted prescriptions for stimulants are associated with two implications, that is, 1. Unnecessary side effects, and 2. Stimulant abuse. The side effects such as appetite suppression, irritability, anxiety, and insomnia are only justified if the benefits of the drug outweigh the costs. As a result, the use of stimulants may not be appropriate for mild symptoms of ADHD. People with ADHD who choose to come off medication often report the so-called zombie effect associated with stimulant use. While medication was effective in helping them concentrate and complete tasks in academic and work spheres, they also experience feelings of apathy, daze, lethargy, and being socially withdrawn. Parents and teachers are often ecstatic to see that medicating children can successfully tame hyperactivity and boost concentration. However, these are only the superficial effects observed from the outside. When the child attempts to notify adults that they dislike taking the pills, they struggle in expressing and reasoning why into words. Consequently, parents may be reluctant in stopping medication due to erroneously believing that it does more good than harm. Moreover, side effects of stimulants can introduce a prescription cascade. For example, increased anxiety may be assessed as another independent disorder, rather than an adverse side effect of stimulants. As a result, a prescription for another unnecessary medication may be taken. College students seek out ADHD medication, also known as study drugs, to help them cram and pull all-nighters. In addition, they can also abuse stimulants for partying. Since the effects of crushing and snorting a high dose of Adderall can be similar to cocaine, Adderall has been dubbed cheap coke. Simply through researching the symptoms of ADHD online, students have the potential to successfully fake ADHD and obtain a prescription for medication. A study conducted by Sandstone and Sandstone involved two groups, individuals with ADHD and individuals without ADHD. The latter group was given 5 minutes to look up the symptoms online, and they were also promised $45 if they were able to successfully deceive the professional clinician in diagnosing them with ADHD. The results revealed that the clinician was not able to distinguish between the two groups, and the two groups were both diagnosed at the same rate. The more common method of obtaining stimulants is through other students. Finding access is relatively easy, as demonstrated by two students from the University of Wisconsin. They were able to find someone who had a friend selling only after 56 seconds of walking into the library and asking a student at random. The Drug Enforcement Administration classifies stimulants for ADHD such as Ritalin and Concerta as Schedule II substances. This means that they have high potential for abuse that may lead to severe psychological and physical dependence. In addition, tolerance of stimulants occurs rapidly, which means people will have to consume larger and larger doses to attain the effects that they desire. The combination of stimulants' quick tolerance and high risk for psychological dependence can get students trapped in a destructive cycle. To recap, ADHD is increasingly becoming misdiagnosed, which is evident in that the percentage of American children diagnosed with ADHD is over double that of the true prevalence set out by the APA. In the pursuit of increasing medication uptake, pharmaceutical companies have played an influential role in increasing ADHD misdiagnoses through direct-to-consumer pharmaceutical advertising, promoting to doctors, and funding researchers and studies. Despite the influence of pharmaceutical companies, prescription pads are in the hands of doctors, who must remain unbiased in their medical decisions. Doctors must conduct ADHD diagnostic procedures judicially and discuss treatment alternatives beyond medication. This will uphold the medical principle of non-maleficence in preventing unnecessary side effects and stimulant abuse. So despite Adderall's name implying ADD for all, the diagnosis, along with its medication, is not for all.